he conducted his experiment on rats. Okay. Am I audible?
Yes, sir.
Yeah. So, yeah. Here in this theory, he administered or conducted experiment on this rats. And in some other examples, pigeon also he used as the subject in this experiment. Okay. So the box that used in this experiment is known as the Skinner box. Skinner box. Here, this theory is also known as the R-type theory. Yesterday's theory of classical conditioning of Pavlov's is known as the S-type theory because why they use the term S means the total behavior is depending on the stimulus. That is the reason classical conditioning theory is known as called as the S-type theory. Whereas this operant conditioning theory of Skinner's, B.F. Skinner's, is known as R-type theory. Why they use the term R means this total behavior is depending on the response. Yesterday's classical conditioning theory is based on the stimulus, whereas this operant conditioning theory is based on or depending on the behavior of animal, behavior of any subject is depending on the response or reinforcement. That is the reason this theory is known as R-type theory. Here in this theory, he thought that the instrument that used in this theory, in this experiment is called Skinner box. Why this reinforcement is so important here? Based on the reinforcement or based on the response of this activity or any person's activity, if you give some type of reinforcement or based on the response only, the modification of behavior is possible. That is the main concern of his theory, that is operant conditioning theory of Skinner's. The fundamental principle of operant conditioning revolve around the reinforcement. Total theory, the total approach of this theory, the total objective of theory is depending on the reinforcement. Okay, reinforcement involves the process of increasing the likelihood of behavior occurring again in the future of the following. It was with a positive stimulus. When we give the positive reinforcement, there is chances of getting positive stimulus. So that is the reason this theory is based on the reinforcement. So that is the reason this theory is also known as the R-type theory. Okay. So here in this theory, as I mentioned yesterday also, the core concept of theory we need to understand and how to apply this theory in behavior modification. As I mentioned, there are some learning theories. Trial and error theory is one learning theory to modify the behavior. So learning means, there is a definition of Gates' definition of learning. What is learning definition? Learning means any one of you, the definition of learning according to Gates or any other scientist, psychologist. According to the Gates learning is modification of behavior through training and experience. I repeat, according to the Gates, GATTS Gates, the definition of learning is modification of behavior through training and experience. Here we are providing some sort of experience to this particular animal or any individual. If you train up the child, he will try to learn something through the training. First part of the learning is training. Second is experience. Out of his own experience, the individual can learn so many things. First one is, for example, if you want to train up the child in initial stage of infant stage, for example, walking. We will hold the hand of the child in a very initial stage of 8 months or 9 months. Okay, we will train up the child to walk, how to walk. Just we will train up the child. Then after that, after some few weeks, after some few days, the child automatically learns of walking through his own experience. So learning of walking, learning of language, learning of any activity is based on these two important steps. One is train up the person, second is his own experience. So according to the Gates, learning is modification of behavior through training and experience. So here also, in this operant conditioning also, we are providing some system, some train up or some sort of experience to the particular animal. So if the animal or if any individual modify his behavior, we will provide some sort of reinforcement. That is known as the positive reinforcement. For example, there is two types of behaviors. One is abnormal behavior and normal behavior, or you can say problematic behavior and normal behavior. So if you train up the person, if you train up the child, if you train up any individual to modify his abnormal behavior to the normal behavior, so we need to provide some sort of reinforcement. That is positive reinforcement. If you provide positive reinforcement, he or she will try to modify his behavior further. Same way here also in this theory of B.F. Skinner's theory. So reinforce is a major aspect. So another important thing is there are two types of reinforcers. One is positive reinforcement. Second is the negative reinforcement. So by using of positive reinforcement, he will modify his behavior and strengthening his positive behavior. We use positive reinforcement to remove his negative behavior. You can say abnormal behavior. We use some type of negative reinforcers. So because this behavior was followed by a positive outcome, because if you provide positive reinforcement, positive outcome you can find. Same way, when we use negative behavior, whatever the behavior is, abnormal behavior, we control, or you can say regulation. There is a chance of controlling this abnormal behavior by providing this negative reinforcement. So that is the reason reinforcement is a major aspect in this operant conditioning theory. There are some principles of operant conditioning. As I mentioned, first one is reinforcement. Okay, in this there are two important types of reinforcements. One is positive reinforcement. Second is the negative reinforcement. Okay, the positive stimulus serves as a reward. If you provide positive reinforcement, it itself is the reward. Okay, for example, of positive reinforcement, praising a student for answering a question correctly during the class timings. Okay, so when we praise the child or student, if he or she is responds or gives the positive way of giving answer, we need to give some sort of praising. Praising is nothing but one sort of positive reinforcement. It is the best example of the positive reinforcement. So that when we give positive reinforcement, the child gives correct response or correct answer. So he will try to do the same activities further, the next sessions also. So that is the one example of giving positive reinforcement by encouraging the child or by praising the student for their correct answer. Same way, negative reinforcement occurs when a behavior is followed by the removal of something adverse, or you can say unpleasant behavior. So when we want to stop or when we want to control that negative behavior, or I can say abnormal behavior, in order to control the abnormal behavior, in order to control the problematic behavior, we need to use the negative reinforcement. Or you can say, if you want to control the unpleasant behavior, we need to provide negative reinforcement. Okay. So the removal of the adverse stimulus act as a reward, making the behavior more likely to occur again in the future. So, for example, if the positive behavior, you want to strengthening the positive behavior, better to give the positive reinforcement. If you want to control the abnormal behavior, so better to give the negative reinforcement. So here, for example, of negative reinforcement, stopping criticism when a child completes their course. For example, if he completes this course, he works, his activities. So better to give negative reinforcement. He or she is not in a position to complete the what are the task is given in the classroom environment. So better to give negative reinforcement. Okay, that is the first principle of operant conditioning theory. Second one is the punishment. The principle of punishment is a significant aspect of the operant conditioning. It plays a vital role in modifying the abnormal behavior. So if you want to modify the abnormal behavior, punishment is one important technique of this modification of behavior. Punishment involves the process of decreasing the likelihood of a or you can say unpleasant behavior, or you can say problematic behavior. Punishment is one technique to control the abnormal behavior, or you can say
Sir,
problem. Yeah.
sir, in that case, negative reinforcement and the punishment are kind
Yes.
of similar thing.
Yes, yes, yes. So here, negative reinforcement of completion of my punishment topic, you can understand. Just try to click. It's
Okay,
three,
okay,
4 minutes.
okay.
I'll
Yes.
complete this subtopic so that we. So here, negative reinforcement is removing whatever the likelihood. For example, removing the toy if he is or she is not in a position to understand your instructions, or if he is not in a position to modify his behavior. So better to just tell them. So if you are not follow my instructions, I will reduce the number of items, number of play items. Got it? That is the negative reinforcement. Whereas punishment is giving some sort of punishment. So here punishment is that again there are two
Okay.
types of punishment. Punishment means one is positive punishment. Positive punishment occurs when a behavior is followed by addition of something unpleasant. So for example, here scolding a child for misbehaving is the punishment, one type of punishment, or some type of imposing the fine for rash driving of a driver. That is punishment. Got it? Here, removing one toy from the play items is negative reinforcement. Whereas in the punishment, imposing some sort of fine is the punishment or scolding a child. There's a difference between the negative reinforcement and the punishment. In the
Okay.
in the negative reinforcement, we are instructing the child. See, if you do this work, I will remove whatever the toys, whatever the play items, whatever the things that is showing interest by the child. We will reduce that. That is the
Okay.
whereas punishment is giving some sort of it is punishment.
Punishment is a temporary solution, and the reinforcement is a permanent solution, kind of.
It's a punishment. It's a punishment. It's a, whereas negative reinforcement is not a punishment.
No, temporary solution. Permanent is punishment is a temporary solution, and the reinforcement is a permanent kind of solution.
Yes, removing whatever the things is available with the child,
Okay.
reducing.
Okay. Thank you, sir.
Yeah. Then here also there are punishment. As I mentioned, punishment is that. So there are some examples already. Scolding a child for misbehaving with the intention of reducing the occurrences of the misbehavior. So the level of punishment is maybe different. Whereas negative reinforcement also some sort of creating some sort of this unpleasant environment to the child. So here, negative punishment. That one is positive punishment. Negative punishment is that removing a toy from a child. Okay. So punishment and the reinforcement. Got it? Yeah. Then third one, first one is, as I mentioned, there are some principles of operant conditioning. One is reinforcement. Second is the punishment. Third is extinction. Yesterday also we discussed about the extinction. Again, I repeat it. Extinction means without, there is no any reinforcement like positive reinforcement or negative reinforcement. We are not giving any punishment here, any punishment or any reinforcing here. If you won't give any punishment, any maybe positive or negative reinforcement, what happens? The child may not in a position to modify his behavior. Just he will ignore. Okay. So another one is the shaping. Shaping means when the behavior is not in a structured way. When behavior is not in a structured way, in a systematic way. So we need to shaping that behavior. Shaping is a technique used to teach or training in a complex behavior, some sort of complex behavior. For example, if you see identifying the in any case of child behavior like autistic cases or ADHD cases, shaping is that in especially in the autistic cases or the ADHD cases, some type of complexity in the behavior you can find. Directly, it's not so easy to modify that sort of complex behavior. For example, sitting tolerance is low sitting tolerance, or you can say restlessness. Okay, restlessness is the one abnormal behavior in these both cases of ADHD as well as the autistic cases. So in this case, you need to shaping the behavior, you need to modify the behavior, especially in the complexity type of behaviors. We have to modify the behavior in stepwise, stage wise. Okay, so first of all, in this shaping, there are some components of, or you can say stages of shaping. One is the identifying the target behavior. Before shaping can begin, the trainer or experimenter needs to identify the behavior. First behavior, or you can say target behavior. Whatever the behavior they wanted to modify, that behavior we need to understand. That should be a complex type of behavior, multiple type of behavior, you can say. So first step is that in this, I'm discussing about the shaping. Shaping. There are some components or you can say some stages of shaping. One is the identifying the first level of shaping is the identifying the behavior. Number one. Number two is the break down the behavior. For example, if you want to change the restlessness, if you want to modify his the behavior of restlessness, you want to improve the sitting tolerance of the child. What to do? You need to change the behavior stepwise. You are already identified the behavior of this particular restlessness or maintaining good eye contact. In some cases of autism, some of you have heard about this word autism. There are some main symptoms of autism. Number one is speech delay. Number two is poor eye contact. Number three is restlessness. Number four is not respond to the name call. Number five is no social interaction, or you can say low peer group interactions. So, for example, if you want to modify one behavior of this particular autistic symptom, what to do? For example, if you want to improve the social peer group interactions, stepwise, first of all, as I mentioned, in this first component of shaping, first level of shaping is identifying the target behavior. The target behavior is that the behavior is that poor social interactions. Okay, so that means we are modifying this type of poor social interactions to maintain the good interactions. Peer group. Here, break down the behavior, that is modifying the behavior. There are some stages, as I mentioned. One is that complex behaviors are often composed of several smaller or more manageable components. We need to break down this major behavior to the manageable components, manageable type of systems, manageable type of stages, manageable type of behaviors. If you want to improve the social interactions, first of all, maintaining eye contact to the peer group. That is the first level. Or you can say just smiling to the other children. That is the first thing, first behavior you need to achieve. First target you need to achieve. Second is, first of all, social smile, or you can say smiling with the child. Second is the interacting with the child. Third one is mingling with the child. This is one type of break down the complexity of this behavior. So when you are shaping the child's behavior, first of all, targeting the behavior, identify the behavior. Second is the break down the behavior in the smaller or the manageable parts or manageable stages.
Manageable short goals.
Yeah, yes. So the same way, for example, you need some other symptoms of this autism is they won't play with the other children. So here you can say there are different type of plays. First one is solitary play, or you can say self play. Second is the parallel play. Third is the cooperative play. And fourth one is the playing with some rules and regulations of the game. So if you find any type of problematic behavior in this playway methods, first one, the child is only play on their own. That means solitary play, or you can say self play. So if you find this is the self play, we need to change this self play. If you want to change this self play up to the, if you want to take this modification of behavior up to the cooperative play, there are some two other stages: self play, solitary play, parallel play, and cooperative play. Though his age is around 5 years or 4 years, because of his symptom of autism, he is or she is not in a position to play cooperatively with the child, other children. So here he only plays on his own, that means self-play. So our target is to change the self-play behavior to the parallel play, then cooperative play, finally playing with the rules and regulations of the game. So here, if there is a complexity of any behavior, problematic behavior, we need to change this behavior step by stage by. Got it? So first one is reinforcement, second is the punishment, third is the Extension. Fourth one is the shaping. So these are the key, some four key concepts of this key principles of the operand. Finally, fifth one is the token economy. When they modify the behavior, we need to give some sort of tokens. The tokens may be the small papers or some sort of animal figures or some sort of any sort of diagrams. Okay, so if they modify the, just you need to tell them, you need to instruct them, you need to modify the, when you are modifying the behavior, be better to give some sort of instructions to the individual as well as the child. If you modify this behavior, these are the 5 coins, 5 tokens I will give you after modifying this behavior. Token economy is that. Even in the modification of behavior, there are some, as I mentioned yesterday, there are some stages of giving reinforcements. Smiling face is also one type of reinforcement. Praising the child also one type of reinforcement. The same type of behavior is maintainable, manageable. Better to give the tokens of some days, of some five. If you continue the same type of behavior, I'll give this type of token. I will give this type of, that is objects, or you can say anything. Got it? Then, as I mentioned, how to apply this, this operant conditioning, or you can say reinforcements in various systems, various conditions, various environments. First one is, as I mentioned, there are some techniques of applying this theoretical core concepts. So one is the application of operant conditioning is operant conditioning. We are giving some sort of conditions. Okay. Conditions means, see, if you show this type of behavior, these are the consequences you need to face. Okay. Then applications of operant conditioning means, here there are ABC model. One is antecedent. A means antecedents. B means behavior. C means consequences. ABC model, you can say. In this ABC model, antecedents means the behavior, that is, what are the activities, behavior before the behavior. For example, eye contact is less, or you can say poor eye contact, or you can say restlessness. That is the antecedent, or you can say activities of abnormal behavior. Okay, so here, based on the child's understanding capacity, or you can say individual's understanding capacity, we need to explain. So if you show this type of behavior, if you do this type of activities, these are the consequences we need to face, we have to face. Before behavior is activities. Behavior modification, before modification of behavior, these are the activities. If you do this, why I am talking about the understanding capabilities. Understanding capability means, for example, if the ADHD case, if the SLD means, you know, the specific learning disability, and even at artistic case also, the capacity of understanding means based on their IQ levels. We need to go to that level of understanding capabilities. For example, though the child may be having some sort of the chronological maybe 7 years or 8 years, but their understanding capacity is around 4 years or 5 years. It means their IQ levels, DQ level is low compared to the normal range of 90 to 110. So better to give the instructions of behavior modification to the child's level, understanding level. So child capacity of understanding, developmental portion you need to check. Yeah, here antecedents, that means activities before modification of behavior. For example, this problematic behavior of a child or any individual. So we need to instruct, we need to explain, these are the consequences you need to face if you show this type of behavior. That is one type of technique, that means ABC model. ABC model is that. Antecedents, we need to identify the antecedent, or you can say problematic behavior of a child or individual or any patient or any client. On this type of behavior, if you show, so these are the consequences it face. In some cases, tantrums, or some cases, behavioral issues of classroom environment. Okay, if you identify this type of behavior, so ask them, just tell them first what are the consequences they'll face if this type of restlessness in the classroom. For example, maybe he is the age of 7 years or 8 years, studying some second or third class. So the main issue, the main complaint from the school authorities, the main complaint from the teachers or the class teacher is he's not sit at one place in the classroom. This behavior we need to modify. We wanted to modify this type of behavior. It is restlessness. Okay. So here, so if you find this is the problematic abnormal behavior, so better to give the instructions. What are the consequences the child has to face in the classroom environment? What happens if he or she is not at one place? It will create some sort of disturbance in the classroom. Number one, that we need to explain to each other. Number two, the other children will accept this type of behavior. Number two. Number three, so if you are not at one place, it's not so easy to understand what are the teachers teaching their classes, their topics. So these are the consequences they face if they show this type of problematic behavior or abnormal behavior in this classroom environment. Those negative consequences we have to explain. Antecedents, behavior, and consequences. For example, if the same model, if you want to apply to the elders, some persons may be having some sort of habits like drug addiction, alcoholic addictions. So here in this case, so if this is the antecedent, so we want to modify their behavior. What are the consequences? For example, if they are addicted with the alcohol or any substance abuse, substances or any sort of drugs, the consequences, negative consequences, we have to explain. Means financial consequences of taking the drugs, health consequences of taking the substance, and social consequences, family consequences, financial consequences, negative adverse consequences of this behavior, we have to explain to the client or you can say patient or any individual. So if you do this type of activities, if these are the antecedents, these are the negative consequences. If you modify this behavior, if you stop taking these drugs or you can say alcohol, so these are the positive consequences. For example, if you spend around 10,000 or some 5,000 rupees per month on this particular alcohol or any other business. So you can explain if you stop, if you modify this behavior of taking alcohol daily or weekly, twice or 4 times, this is the amount you are spending on this particular thing. If you stop this behavior, if you modify this behavior, if you stop taking this substance or you can say taking alcohol, this much of amount you will save per month. That is financial positive consequences. Then positive consequence is health, positive consequence of the behavior of his family, positive consequences of society. So this is one type of ABC model, one example of ABC. Antecedents, behavior, and consequences. Any doubt? Yeah. Then Another important this aspect of this antecedent behavior and consequences. There are different ways of explaining this ABC model. Antecedent, or you can say activities. Yeah. It is antecedent as well as activities. If these are the positive activities, these are the positive consequences in here. If these are the negative activities, these are the negative consequences we have to face. Those things we better to explain to the client or the patient. Okay. So in education setups also, especially in the operant conditioning, generally this ABC in education section, educational setups, teachers use reinforcement technique to encourage the positive behavior and motivate students to perform well in academically. In academic aspects also, teachers use this type of model, that is the applications of whatever the operant conditioning is helpful to the teachers also, the parents also. For example, if the in education setup, teacher use reinforcement technique of operant conditioning to encourage positive behavior and motivate student to perform it well academically. So if he or she is not academically perfect, not performing better, but performing not proper performance of the child in the classroom environment, so the teachers can use this type of technique, ABC model. See, if this is the case of the child, so the teacher is supposed to explain, or the counselor of the school council is supposed to explain. So if you want to perform, these are the techniques you have to follow. Or you can say motivating the child. If he or she motivate from your instructions, what are the motivational techniques if we use? If they modify their behavior, so better to give the positive reinforcement. Parents also use operant conditioning principle to shape their children's behavior. As I mentioned, shaping the child's behavior, rewarding positive actions and applying the appropriate punishment. If he or she is not modify his behavior, there are some techniques of giving punishment. Okay. Behavioral therapy, as I mentioned, Esther, this all comes under the behavior modification technique, BMT, or you can say BMT program. BMT or BMT program. So another technique is applied behavior. One is ABC model. Another is ABA, applied behavioral analysis. Applied behavioral analysis. In this applied behavioral analysis, we need to check their behavior, analyzing their behavior. As I especially yesterday also I mentioned it. So here applied analysis or applied behavior analysis, you need to analyze the behavior of the child or individual. In the both cases, for example, the behavioral issues of the child or any alcoholic or substance abuse cases, we have to analyze and why he is taking the type of this why he is addicted to this substance, why he is addicted to this drugs. You need to analyze it. Some type of cases or some type of individual, they'll think that this is status symbol. Taking cigarette smoking is status symbol. That is the way of their thinking. So we need to change their. If it is the case, be better to analyze why they are using this substance, why they are taking this type of, why they are using this type of drugs, why they are taking this type of, why they are habituated to this substance. Analyzing their capabilities, analyzing their situations, analyzing their thought process, analyzing their thinkings, analyzing their you can say it is the environment. Some individuals they'll tell, so I am I don't have proper this restlessness. That is the reason I am taking this type of. There is some sort of stress in my job, my workplace. That is the reason I am using this type of substance. I am habituated to this because of this reason. Analyzing their situations. Then applied behavior analysis is a psychological intervention that applies principle of learning. So here we are applying this type of learning principles. What are the learning principles? Maybe tile under a type of learning theory, classical conditioning theory of learning, operant conditioning of theory of learning. Especially this particular operant conditioning theory is quite suitable to apply this applied behavior analysis, to use this ABA. Okay, this was originally developed by psychologist Lovers in 1960, reflecting traditional principle of behaviorism. It is one type of traditional system of behaviorism. He is well-known psychologist for his research on application of behavior analysis to teach autistic children through prompts, modeling, and positive. So even in this autistic case also, this ABA is applicable. The technique frequently applied to children with autism and other developmental disorders that focus on the, for example, if you want to improve, as I mentioned, developmental disorders mean some type of disorders related to the developmental procedure, developmental milestones. As we know, these some developmental milestones are supposed to achieve in this particular age group. For example, social interactions, learning skills, motor skills, okay, and some sort of communication skills, social skills. These are all the skills. Yeah, these are all the developmental milestone that child or the individual is supposed to reach, supposed to achieve in so and so age groups. For example, social skills are poor, or communication skills are poor, academic performance is not up to the mark, learning skills are slow, learning skills are not up to the mark. Here, we need to analyze the situation. Why this academic performance is poor in this particular age only, in this particular class, or in the previous class also. For example, in some students, their performance is excellent in the previous classes. When they reach in this class of 8th or 9th class, they may not be in a position to perform well compared to the previous classes. Here, analyzing the situation of the child, whether any change in the school environment, any change in the classroom environment, any change in this home environment. These are the various aspects we have to check, we have to analyze. Why this behavior of child means not performing well, not performing good compared to the previous performance. Why it is happening in this particular age? Why is it happening in this particular class? Why it is happening only in this particular subject? Got it? So here, so this applied behavior analysis is analyzing the various conditions, various situations of the child in order to modify his behavior. This applied behavior is also depending on the operant condition. Or in some cases, no, that is reinforced, though some children are performing good compared to the previous classes. Up to 7th class, their performance is poor. Their performance is not up to the mark. When they reach this particular class of 8th or any other classes, their performance is improved. But no recognition, no identification from the parents, no reinforcement from the teachers. So here, when we are analyzing the various situations of this particular case, then only it is easy to understand the case in a better way. Here also, reinforcement plays a vital role in modification of the behavior. So even when we are improving the social skills, As I mentioned, development, there are so many developmental disorders, developmental issues. Okay, yeah, development, as you know, development means physical development, psychological development, cognitive development, social development, emotional development, then moral development. If we find any developmental delay, developmental disorders, developmental issues in this particular case, we have to find out the reason. When in order to find out the reason, we need to analyze. Then only it is possible to apply various techniques of this modification of behavior. That is applied behavior analysis. For example, their social skills are not up to the mark in this particular age group and this particular environment. Previously, their social skills are good. They used to mingle with other children in the group in the previous classes and the previous years. But whereas when they entered in this new school, when they entered in this new environment, their social skills are not up to them. Maybe changing of the language. In some central government job holders, the children of this particular parents are repeatedly, maybe after 3 years or 4 years, they are supposed they'll change their environment. They admitted the child in different environmental different schools based on their transfers. So here, analyzing the situation, why his social interactions, social relations like in previous years, previous stages, why it is not up to the mark in this point. As I mentioned, academically also, socially also, economic development, social development, even the emotions also. For example, emotional development also. In developmental milestones, developmental disorders may be various stages. For example, in some cases, when they reach, especially in the God's case, when they reach in the age of 14, 13 age group, so some sort of emotional issues they'll face, some sort of emotional problems. In the previous years, like 10th year, 9th year, 11th year, this girl is used to mingle with all the neighbors in all the other children in the classroom environment. But whereas when she entered in this age group of 13 or 15, 14 years, because of her rapid physical growth, some hormonal changes, some sort of fear, some sort of anxiety in her life, at least you can say developmental these things, maybe some sort of developmental changes of his physiological. That may be one of the reasons of her not mingling, not interacting with other children in their classroom, maybe. These are all the various factors. Any psychological psychological issue when we want to address the psychological issues. What to do? First of all, we need to analyze various factors of this particular case. Then only it is easy to get the solution. Direct solution or tentative solutions in the psychological counseling is not give any positive result. So here in this ABA, applied behavior analysis, so we have to analyze various situations of this particular case or client or the child, especially in the behavioral modification technique. This is the one technique of applied behavior analysis. Okay, first model is ABC model, antecedents, behavior and the consequences. And in ABA, is a commonly used as a therapeutic intervention for individuals with autism and other developmental issues.
Disorders.
Any doubt? Yeah, something.
No, sir. No. I was giving the answer. That's it.
Yeah, yes, yes. So here, for example, in this positive reinforcement is one of the main strategy used in the ADA. As I mentioned, it's one important technique of applying this. When you are applying this ABA model, positive reinforcement is the one main strategy or techniques you need to use. When a behavior is followed by the something that is valued, means a reward you need to give. A person more likely to repeat that behavior. For example, whatever the modification of behavior, as I mentioned, from this problematic behavior to the normal behavior, we need to give some sort of reward, that is positive reinforcement, to continue to manage, to maintain that sort of positive behavior. Okay. For example, for even in some cases of old people also, this ABA is applicable. Means some sort of, for example, if they are above 75 or 80 years of old, they'll have some sort of memory, some sort of issues related to the this dementia, you can say Alzheimer's dementia. So here, stepwise, you can give some sort of instructions. So you just that is analyze their condition by in some cases of old age people. Negligence from the family members also. They won't give any importance to the uh, elder people after reaching some 75. They'll ignore their instructions. If the other family members ignore their instructions, slowly, what happens? These old age people detach from the family member. Emotionally, they'll detach. Instead of having some emotional attachment with other family members in the family, they'll detach. अरे मैं तो कोई किसी काम का नहीं हूँ. I am waste fellow in this. If they came to that conclusion, the interaction with other children, other family members may be slowly, it is reduced. So it leads some sort of psychological issue, some sort of memory issue, some sort of dementia related symptoms in this old age people. In this case also, so you can apply this type of behavior modification. Just ask them, no, that is not our interest, that is not our conclusion. Because of these reasons, we are not in a position to interact you. We are not in a position to spend that much of time. So these are the ways you need to explain to the older people. So various ways, various stages, you can apply this type of APA model as well as the other reinforced techniques. Any doubt? Anything you want to add? Anything you want to ask? Last, we have 2 minutes. So as I mentioned, only first of all, you need to understand the core concepts of learning theories, or you can say here. See, there's a. I think some of you are my students in the PG psychology course. So any theory like learning theories, personality theories, learning theories are different. Learning theories like trial and error theory, and what is operator conditioning theory, classical conditioning theory. And tomorrow we are going to discuss the social learning theory of Banduras, Albert Banduras. So these are all the theories, various perspectives we need to check. We need to understand. Learning theories are these are the learning theories. How these learning theories are applied to the personality. The approach of the behavioral approach, how the behavioral approach linked with the personality. That is our concern. That is our way of studying this behavioral approach, psychoanalytic approach. Yes, you might have heard about the psychoanalytic approach. You already studied the psychoanalytic approach in the starting units. How the conscious, how the subconscious, how the unconscious levels of our mind. What is the link of this particular personality to this conscious, subconscious, unconscious level of mind? Levels of same way, id, ego, and superego. The characteristic of the id, the characteristics of the ego, and the traits of superego. How these dynamics of personality impacts on our behavior. Okay, this is the way we need to study in this uh, course of PG diploma. Okay, thank you.
Thank you, sir.
Thank you, sir.